Hello again, Dr. Stu Currie here with MojoFeet, continuing in our series of demonstrating the Mojo Matrix Pin Scanner and how to use it. So we're going to continue with our patient John test here, and the next stage we're on is the analytics screen. So we're going to move to the analytics screen by clicking across the top on that tab. Maybe, there we go. First thing you see on this screen, the biggest thing on this screen is the left and the right foot inside profile. What you actually have here is a comparison inside profile between the corrected version of the patient's foot and where they collapsed to when they stood on it. So your stance phase. So if you look at this left foot, we have a black line over here which goes across the top, which is the corrected version of the patient's foot. We have a blue line underneath it, which is where they collapsed to. And then we have this purple space in here, which is just representing the space through which that foot collapsed. You have the same thing for the right, which I will move myself out of the way here so you can see it, but it's similar in nature, right? Okay, so I'm going to focus your attention on two numbers at the top left of your screen. These two numbers are the key to the whole thing, and they're what we're going to focus on when we are talking to a patient. They are this purple corresponding to the left and the red corresponding to the right arch drop percentages. So these are percentages that the foot dropped as it went through its range from corrected to stance, right? So in this example, you see that the left foot collapsed 70%, and the right foot collapsed 54%. What that correlates to is a chart you were given, which I'm going to bring up, which is in our new scanner packet on the desktop. It's the arch drop percentages. You can see that when a patient collapses 20 or 30%, we're going to call that pretty good. Your foot should collapse when you pronate, right? It's a normal part of the gait cycle, even though pronation kind of gets a bad name. It's one of the ways we shock absorb, right? And transfer energy, including some of the other flexions like ankle dorsiflexion and knee flexion. Foot pronation is part of that package that helps us shock absorb. So some of it is normal. When you're in the 31 to 50% range, you're looking at somebody who is in that zone of, okay, they probably collapse a little too much, and depending on their age will dictate where their symptoms are at and what you might do about it, right? This could be somebody that you use one of our prefabricated orthotics on as a trial because they may not need the full custom ride. This may be somebody you give some foot exercises to and have them go away for a few weeks to work on them at home and come back and see what their symptoms are doing. If it's a young patient, you definitely want to keep an eye on it. The older they are, probably the more set this is, and so you may choose to intervene earlier. When you have a patient that's over 50%, and this is like the example we're going through now, you've got somebody who probably already has foot problems. So some biomechanical problems related to an uncontrolled foot. So think of plantar fasciitis, maybe some metatarsalgia, bunions, those kind of things that can be related to a lack of control of the foot. When you're over 50%, you're kind of in that zone, and this is somebody who you probably want to intervene with a good level of control in the form of a custom orthotic. So that chart is here for you to reference to. And I'm going to continue along with my example here. So we're on the analytics page. We have a patient that we're speaking to. I'm going to focus on two things with that patient. Number one, the value of those numbers and how they relate to normal or ideal, right? So for Mr. John test here, we'd be explaining that his left foot collapses 70%, his right foot collapses 54%, and we like to see those numbers in the 20 to 30% range. So this indicates a lack of control of his foot, right? The second thing we're going to talk about is any big differences we see between the right and the left foot. So in Mr. Test's case here, we have a difference of 16 degrees between his left and his right foot. I would point that out. At that point, the patient often would jump in with, oh, is that why my left foot hurts more? Is that why I have plantar fasciitis more on the left? Is that why my knee pain is worse on that side? Of course, you take these numbers with a grain of salt. Is it always the side of more pronation that has more pain? No. As we all know, we can compensate on the other side for that excess pronation, and that may be where the pain shows up. But in general, that's something we can point out to a patient because they know their asymmetries very well. They may not know why it's happening, right? Or why their right knee hurts more, but they know their asymmetries. So again, recapping their numbers and how they relate to the normal ranges, where they fall, and then pointing out any big difference. When I say big difference, I'm referring to 10% or more. So if it's under 10%, I may not mention it. I might take note of it, and if I see asymmetries in the patient, then we can go from there. But when it's 10% or more, I'll usually bring it up with the patient and have a chat about that. So, side note, a prefabricated orthotic, or for that matter, orthotics from some other orthotic companies, aren't different right to left. So when we are talking about differences right to left, it's an interesting topic to go into, one for another video, but I do want to point out that the asymmetric pronation can be related to some things up the chain, right? Pronating more on one side than another. And that can have an effect. It's also something that only a custom orthotic will account for. In other words, we will do, your orthotics will come out different arch heights right to left, and possibly different flexibilities right to left, depending on how much we're trying to control. So a more flexible or uncontrolled foot needs more help from the orthotic. That's just one extra way that we tune these things to help deliver the best custom to the patient, right? So those are the two things I would focus on with the patient, followed by a recommendation for care, which could be, with this patient, they're over 50% on both sides, and they have a big difference, 16%, between their left and their right foot. The recommendation would be for a custom orthotic for this patient. Helping the patient along, illustrate the importance of some of this stuff, we have this biomechanical analysis here, which is, this video, which is the little skeleton guide down on the bottom left. I'll click on them, and up will pop sort of a video kind of doing some of this talking and explaining for you. So this is a video that sort of shows, okay, when the foot collapses, the tibia rotates inward, the knee comes in with it, the femur and pelvis on that side also come in and internally rotate, and it helps describe, and I think it'll zoom in here to just kind of get it in more depth. It helps describe and show why we might be thinking about the feet clinically when we are talking about, say, hip pain or back pain. So some offices leave this video on as a screensaver to help with demos for patients, but it's a good way to chat and sort of illustrate for patients why the feet are important. I'm going to minimize that for now. We also have, if you had a patient in front of you with, let's say, bunions, you could click on our bunion pathology, click over here, drop down, and you would see just a picture of a bunion and some of the things that could be going on if you'd like to talk to them more about what that is. We have a few different ones over here, a few of the more common ones. Just continuing to explain everything on this screen, we have a print button that will obviously print this. You can print that to a PDF, or you can print it, to a piece of paper and hand it to the patient. We also have a few other numbers here that you'll see. These are sort of more advanced numbers involving inclination angles and declination angles, and quite honestly, you won't use those very much. If you're ever consulting with me on maybe a more complicated case, we might dive into some of those numbers, but they're kind of geeking out, and for the vast majority of people, you're not necessarily looking into that depth. So you can kind of put this chart to the side, but I want you to know what it is. Continuing along and what we can print off, if we go back to the scan screen, at the bottom of the screen we have this biomechanical assessment. So if we click on that, we're going to see a summary of all the patient's numbers. So I'm going to move this over so you can see it. Again, this form is printable. It's not new information as far as numbers go. You can see the 70 and the 54% there, right? They're just represented graphically slightly different in a chart and sort of these odometer kind of things. You also have other diagnoses that you may decide to kind of let the patient know that they have or note for yourself in their chart. You can print, which again can be done to a PDF for their file digitally or to a piece of paper for their paper chart. Scrolling down, you have a few other recommendations as well as a orthotic prescription form. Should you be going down that road, you can use that if you would like. Perfect. Those are the things that are kind of come with the analytics page as far as talking to a patient, making decisions clinically about their foot and deciding what to do, as well as showing them what you're doing and why.